are very fortunate to have Dr. Keith Smithson with us. He does sports vision therapy in that realm. I'm gonna let him kind of tell you a little bit about what he does, and then we'll get into some of the fun stuff.
Yeah, great. Thanks for having me. Practice outside of Washington, D.C., so Northern Virginia area. We have 4 locations, multi-doc practice with pretty much every specialty under the sun as far as optometry goes. And my opportunity inside that practice is doing sports and performance vision. So, I have the good fortune of working with every professional sports team in Washington, D.C. So we have a chance to work with athletes in preseason physicals, to be around for injury management, vision training, visual performance training, post-concussion rehab. So an awful lot of things revolving around sports and vision. So it's fun to talk about it.
Yeah, that's awesome. I think that's one of those things that people think, oh, that'd be really cool to do, but sometimes they have no idea how to really do that or bring that to their practice. We're always talking about new grads marketing something they can bring to a practice, and I think sports vision is a very interesting one. So let's kind of start at the base. What exactly is sports vision? Is it just how to throw a baseball better? Is it, what does that encompass?
Yeah, so for me, sports vision just simply means, meeting the visual needs of an athlete, right? And it's as simple as that. So all of us as practitioners have the opportunity to work with athletes every day. Whether or not we consider ourselves a sports vision specialist or a performance vision specialist, you can't tell me that you go through a clinical week in practice and don't see an athlete. We all do. So whether they're a 16-year-old baseball player who simply needs contact lenses or, an athlete looking for visual performance enhancement, we all work with athletes. So how do we meet their needs? And I think that's kind of what sport vision is, and then we can expand upon that.
So how do you meet their needs? How do you take it from that level of just, maybe getting them in the best lens or the best, the safest lens or those sort of enhancements that most of us are fairly familiar with, to that next level to make it a true sports vision program?
Yeah, so, I think the first thing is a change of thought, right? And so a lot of people ask me the same question: how do I get involved in this? It sounds fantastic. It sounds exciting. How do I work with a team? So, I think the first thing you do is that you change your mindset a little bit when you hear that, this patient that you're now encountering is an athlete. So, if somebody mentions that their eyes are dry or someone mentions that they have a family history of glaucoma, it changes and flips some switches in us and maybe some testing that we might do. So the same sort of thing for vision, right? If someone says, I'm an athlete, or, mom's sitting there saying, little Johnny's on a travel baseball team. So, let's look at some of the things that we know how to test. Let's talk about, some depth perception components. Let's talk about some contrast sensitivity testing. Let's look at a little bit more dynamic vision testing if we have the capabilities of doing it. But, I think it starts with a little bit of a change of thought that this is an athlete and maybe they require a little bit more from a testing standpoint. But I think, again, I'm very passionate about this. I think all of us as optometrists have the ability to work with athletes and be a sports vision practitioner. Whether or not you take it to the next level and become sort of a specialist in sport vision is certainly as open-ended as becoming a specialist in glaucoma, dry eye, or anything else. So those opportunities are there. I think we'll talk a little bit about the technologies and things available for it, but I think it starts with just a change of thought.
Yeah, it sounds like it's very similar to dry eye in that you can start at the base with things that you have in your office already, your stereo test and your things of that nature. And then if you want to graduate it to a different level, then there's tools to do that. How do you kind of do that dynamic testing? What exactly do you add on that you may not have done in just a standard regular exam on a non-athlete before you take it to the next level? Is it just more stereo testing? I know you mentioned dynamics, contrast. What exactly are you doing in your practice?
Yeah, so for me personally, it's starting at the base of what our profession is built on, which is refraction, right? So taking time and being precise with the refraction and dealing with potentially minor amounts of SIL or dealing with a UV protected contact lens as opposed to something where indoor sports may not require things like that. So attention to detail and refraction is simply the foundation. But then looking at some measure of ocular alignment and binocular skills testing, certainly a hallmark of what we do. Some kind of a muscular assessment, some kind of a contrast sensitivity test, as I think a must as well. Obviously, the health component plays into it with sports. I mean, sport vision can mean simply that, I'm a pitcher and my eyes are itchy and irritated when I'm on the mound, and this doctor provides me an eye drop that stops my eyes from itching. That's sports vision, right? You're performing better at your sport without rubbing your eyeballs out. So, I think that's the base and the foundation of it. And I'm very passionate of the fact that we can all do this and we can all start there. And then, again, if we do take it to the next level, there are exciting technologies out there. I mean, I personally use things like Right Eye. I use things like NeuroTracker. There's Synaptic. There's a lot of wonderful technologies that weren't there 15 years ago when I started in sport vision. So there are technologies that you can invest in, that you can bring into your practice and add a specialty, just like again, you can't treat glaucoma today without a visual field and an OCT and all these things that we look at as a staple of our practice. But if you look at the staples of sports and performance vision testing, it doesn't simply mean you have to work with professional sports to be applicable. We're talking about driving. We're talking about law enforcement. We're talking about anything that visual enhancement and visual performance skills are critical for. And there's technology out there to assess some pretty amazing things.
Speaking on that, so let's say we do the testing, we figure out that there's some deficiency in contrast or depth or whatever it may be. What then? How are you treating that? What the therapy part? How does that come in?
Yeah, so I think, obviously, just like anything else, clinical decision-making comes from doing the assessment first and then having the interventions that you can put in place to match up with the deficiency in this case, right? So a lot of it is refractive. Some of it is muscular training, right? So a lot of us have a foundation in some level of vision training from a muscular standpoint, dealing with convergence issues, muscular issues, accommodative issues. So, pick your poison as far as the way that you want to treat things from a binocular standpoint, but that's been something that's been taught in our profession for 50 years. We turned our back on it until physical therapists and occupational therapists started doing it, and now, we lost basic vision therapy. So shame on us as a profession. There's a lot of great things out there that we all should be doing. So that's the foundation of it. From a really, sort of higher level standpoint, on a performance standpoint, there's strobe training glasses, there's visual training apps, there's visual performance and visual processing enhancement programs. There's a lot of technology that we can use for training that we can go back and go to those assessment technologies and look at, quantifying results. So there's some really exciting stuff that you can get into that doesn't take up a large footprint in your practice. Right Eye is one of my favorites. I use them all the time, but only because it's a platform that allows me to do a multitude of different testing, from visual performance testing to pre- and post-concussive measurements to binocular testing for a kid who has issues with reading. So you simply click on the right app and do the right version of that testing. So things that we're all familiar with, very easy to administer even by your technicians.
Great. So when you're first starting to kind of build that side of your practice, how do you market that? How do you, go to those teams and say, hey, this is something I'm doing. Let me work with your players, or do you go to the player first, or how does that access work? Or I'm sure you don't just day one walk into the Nationals and say, hey, I'm going to be your doctor now.
Yeah, they get a lot of those knocks on the door, right? So, the first thing is to build trust, and the first thing is to do it for the right reasons. So if you're out there just to put, a fancy jersey up on your wall or market, then I think that's the wrong way to do it. So if you're truly there for the right reasons, it's going to show, just like anything else. So be authentic, be passionate about it, and always the gatekeeper for the most part is the athletic trainer. So athletic trainers and optometry have a great reputation and relationship. I have an opportunity to lecture to the NATA every year, which is the Athletic Trainers Association meeting. And so we continue to try to ring the bell of how important it is to make a relationship with an optometrist. And so for me, the athletic trainer is a lot of times the gatekeeper. Whether or not you live close to a professional team or a collegiate team or a high school team, you have an athletic trainer that you can make contact with, and believe me, they would be thrilled to know where you are and what you can do to help manage a corneal abrasion or a contact lens issue, or even fit a contact lens. So knowing that they don't have to necessarily send somebody into the mall for a vision test that they don't necessarily know that they're going to get some results back from, building trust is number one. And trainers is a lot of times the first one to talk with that.
Great. I've heard some people say that concussion world is a good place to start, because that's obviously a big buzzword in sports these days and in general medicine. Do you feel like that is something that, if you're going to do sports vision, that you really need to verse yourself in, or do you think it's more of the BV stuff?
Yeah, I think it's a great question. For me, I think it's absolutely yes. And I didn't get into sport vision to be a junior neurologist. It certainly wasn't what I designed myself to do. But the evolution for me happened about 10 years ago, when concussion really started to kind of pick up, in the media and sort of what it was all about. And there was a test being formed at that point called the IMPACT test, which is done out of the University of Pittsburgh. So they built the IMPACT test as sort of the gold standard for concussion detection and management at that point. And meeting the inventors of IMPACT at that point at our combine in Major League Soccer, we sat and listened to things like visual reaction and visual memory and all these words that sounded a lot like things I was doing. And it sort of was an obligation at that point to step up and say, I think we can do some things together here. So for me, yeah, absolutely, concussion is a big part and a big opportunity for our profession. I lecture a lot on primary care optometry's role in concussion management. And I'll start the lecture by saying, who in this room kind of feels like they can manage concussion? And you get maybe 2 or 3 hands up. and hopefully by the end of the talk, everyone has their hands up. So I think for me, 2/3, for the most part, of concussion management can happen in every single exam room with every clinician who has the letter OD at the end of their name. So I think it's got to start there in the understanding of what concussion really means and looks like and the visual components of concussion. But I can tell you, personally, I have referrals every single day from a concussion center, whether it be a neurologist, a neuropsych, a team physician who says, there's a visual component to this concussion and I need someone to deal with that. And they do. They have basic vision training under their roof already. But when it's something they can't manage, they send to you. And I can't tell you how many times that's basic underlying anisometropia or some level of a binocular vision issue that might have been there inherently and underlying, but sort of asymptomatic. But for me, absolutely, concussion is a big arena, and in optometry, it's something that we should have a place at the table. We advocate for that through the AOA as well. It's a great resource, and then we'll get to that a little bit, but the AOA Sports and Performance Vision Committee is something that I chair currently. It's a wonderful resource for all optometrists. Jump on, take a look at it. There's a lot of pillars on there of sort of what we stand for, what we're about, but a lot of educational resources, a lot of taped and online webinars and things that we've done in concussion, performance vision, performances testing and assessment. So it's a great resource to go to, and it's something that I think concussion is a massive opportunity for our profession for sure.
So when you do have that concussion patient, are you, obviously it'd be ideal to be able to be on the sideline of every game, but that's not practical. So are you working with that trainer and enhancing their way of, recognizing the signs and symptoms and testing on the sidelines or in the dugout or whatever the case may be? Are you distributing tests for them to do at the games, or is it, send them to me after you pick up on these and we'll go from there?
I think that's C, if I counted the opportunities right. Option C. So for me, it's I'm very passionate about the fact that I feel personally that optometry's role is sort of as an integral part of the rehabilitation team for concussion. I don't feel like our role is to be the first line concussion detection or the return to play doc. I've been on that side from a medical legal standpoint, and to be the one who has to make the call that someone's safe enough to go back on the field is something we do not want. That's my opinion. The way it works for me personally is, and in every professional team there are different protocols. So the NFL, Major League Baseball, NHL, it's all handled very differently. So essentially the assessment's done through the team, through the protocols that are put in place by the league. But once, again, they identify that there's a visual component to the concussion, that's where they're sent in for the rehabilitation component that I'm going to deliver, essentially clear them from the visual standpoint, and then the overall clearance that this athlete is ready to begin their return to play progression happens through athletic trainer or concussion specialist, whatever the league is.
Yeah, I think you touched on a really good point. Medical legal is obviously a very big concern for everybody. Nobody wants to get in hot water in that realm. So when you phrase things like you were cleared from the visual perspective, then you're staying within your realm without, doing what you can do, clearing on your end, but you're not that ultimate decision maker. And I think that that's a very important thing to touch on. Equipment with sports vision. There are some really fun things that are out there. Where's the best place to go to figure out all those resources? Is there a good reference online?
So as of right now, I would tell you that AOA, we have at Optometry's meeting, we do a sports vision panel, essentially a forum where we invite technology to come in and present. So it gives an opportunity for the attendees to actually go and have hands-on opportunities to work with technologies, learn from those technology companies, which I think is a unique opportunity. There's a website that we've started called Sports Vision Pros. Sportsvisionpros.com is a place to go and actually have hosted content from technology companies talking about what they do, what they build. Myself, two of my colleagues, Dr. Horn, Dr. Cunningham, who practice in multiple locations doing also professional sports, have an opportunity to discuss the different technologies and how we use it in clinical practice. So I think that's a great opportunity and a resource as well. And for us, really kind of the Bible right now of sports vision is Dr. Graham Erickson's book on sports vision. So it's a great resource, something you purchase easily through Amazon, and look at something that does have basic assessments in the back of it and a template for what it looks like, and a lot of discussions about technology too.
So do you think you have to be a big VT person? I think some people get scared away by that, that realm of optometry, and they hear different takes on it and whether or not it works. And some students say, oh, no, I don't like VT, but I kind of like to do sports vision. Do you think you have to be passionate about the whole world of VT to do sports vision, or do you think you can, incorporate that and learn as you go and maybe become, down the line, a little more passionate than you thought you were?
So, that's a great question. So for me, one of the problems with sport vision over the years is that it's been associated with VT. and sport vision is not VT. And we actually made a concerted effort through the AOA to actually. It's amazing how difficult it is to change the name of something. It took us a year and a half to change the name of the sports vision section in the AOA to now the Sports and Performance Vision Committee. And the entire aim of that was to be more inclusive and say that sports and performance vision is, again, back to the fact that we're trying to maximize visual performance for every patient we come in contact with, regardless of the fact that they play sport, right? So even if you're the mom driving back and forth from soccer practice, you're getting on an 8-lane highway and driving out doing some very dynamic skills. That's performance vision, right? So our law enforcement people that come in every day for their eye exams, that's performance vision. You're talking about life and death situations with threat assessment and visual training. So VT, to me, has always been a part of what we do from a performance vision standpoint. But when I went to teams personally and talked to trainers and said, this is what I do in my practice, I always presented myself as someone that could meet all of the visual needs of that sport. So I think that's important. I think it's important to say that, look, I can fit your contact lenses. I'll be on call for medical emergencies. I'll treat and manage concussion rehab. And by the way, we also do performance-based vision. So it's a part of what we do, but it's certainly not something that I feel like I stand on a box and say, I'm the VT guy, come to see me. I think that's hopefully something we're trying to dispel that myth. That's not sport vision.
Yeah, I think that's a great point. You can start in other ways and incorporate that as you learn more and become more comfortable with that world. So this is definitely a topic that we could talk about for hours and probably still just barely scratch the surface. So is there anything that you would like to leave, with our audience and our viewers to kind of, high points, things you want to wrap up with?
So I would say, number one, the point that, again, we all should have a basic information or a basic background in sport and performance vision. And it's simply because every one of us is going to make contact with an athlete. It's just simply part of standard of care, in my perspective, in making sure that you're matching the needs of those athletes. I'm very passionate about the youth sport angle and what sports are. I mean, again, I work with professional sports every day. But for me, the reason I do it is because the 10-year-old kid that can't see, that fails at the sport he wants to play and be good at, takes away that opportunity for that child to learn the life lessons of sport. And for me, that's what sport's all about, is learning, those life lessons, how to work hard, how to be a team member, how to, not give up. Those are the kind of things that I want my kids to learn from sports. I don't need my kids to play professional sports. I want them to play sports because I want them to be good at what they do, whatever that is. So if we're missing an opportunity with a child to test or manage vision in a way, the pediatrician told them they were 20/20, so everything was fine, right? Well, the kid's got a high exo at distance and can't hit the fastball, in 10-year-old baseball. So he quits because he doesn't like the game anymore. So that's a missed opportunity and a missed child's life, of growth and potential. So I think that's the other part of it, is, again, really being open to that. And the last point I would make is, again, from a vision and performance standpoint, what we did talk about for years was the performance enhancement angle. And I think there is sometimes some pushback on, well, where's the studies, where's the research? And I would argue that there is studies and research out there. But what's really made a difference for us from the talking point standpoint is injury prevention. So, there was a study released a couple of years ago at the University of Cincinnati with their football team. They did 3 years of concussion testing on their football team and found an incident of concussion. Then they did 3 years of visual training, and the 3 years of visual training showed a significant reduction in concussion risk. So if we're now talking to a parent and talking to an athlete about the potential of keeping them safe and keeping them on the field, that changes the discussion point a little bit about, little Johnny could be better at what they do. We can also potentially keep them safe. So I think that's a big point, and also what we try to do as a profession is do good, right? So we're looking out for the welfare of these patients' eyes, and this chance also an opportunity to look out for the overall welfare of the patient.
Yeah, great point. So we're actually going to switch over to a panel on different practice modalities, specialty practice being one of them. Dr. Smithson's going to stick around for that as well. So if y'all can hang around, please do. Otherwise, thank you so much for doing this. We'll definitely have to do it again.
Thanks for having me.